Cause and Effect. I'm also on the board of directors. I'm also the vice president of the UFC SU club that we run. And it's been quite a success. Tonight it's about mental health awareness, and it's an open mic. I didn't really know how to talk, how to present, if I'm supposed to give some sort of a presentation that's formal. But because it's an open mic, I was like, okay, whatever. I'm just going to write it down and I'm going to speak.
Don't cover up the ball of the mic.
Sorry, that's just a rapping hip hop thing. You gotta try to beatbox and whatever. So, my background: I'm a year 3 student at the UFC Faculty of Nursing Registered Nursing Program. It's a 2-year program. I'll be done December next year. I'm really happy to see Kendra here, who is a fellow student of mine. She's also special to me in the sense of she's a friend of mine. We spent a good 8 months together working on a lot of things together, and she'll be able to vouch for some of these experiences I'm going to share with you. My first experiences with mental health issues were actually as a registered kinesiologist. So I work at a physiotherapy clinic. I deal with a lot of folks that have chronic pain. A lot of these folks have post-traumatic stress disorder. A lot of them are addicts of sorts. And I've done graded exposure therapy, CBT, and counseling with the help of occupational therapists and psychologists. My Term 3 community health practicum in nursing, we ended up kind of focusing on high school students and mental health, addiction, and stigma. Term 4, I was placed at the Alex Center. Does anybody know what the Alex is? I know Michelle does.
I do.
They got good work. They're great work, actually. So they have a youth center, a seniors clinic, and a program called Pathways to Housing, which is one of the most innovative, brilliant things that I have ever seen. Term 5, which is right now, I actually just switched out of there, but I was placed at an acute mental health ward in the Rocky View Hospital. So I wrote out kind of a summary of my experiences and thoughts, anecdotally, reflectively, just as an outside observer that can't really say much or do much just because I am a student. So I just want to present that to you. When we started as students in community health, we initially felt that it was very slow going. We didn't practice any skills in our setting. It involved mostly windshield surveying, IDing vulnerable populations, as well as finding community health needs. I became more aware of the stigma that surrounds youth mental health and addiction through that placement, actually. One interaction that stands out was with a guidance counselor at Queen Elizabeth High School. Does anybody know Queen Elizabeth? Has anybody been to Queen Elizabeth? Yeah, there we go. I went there too, and I'll get into that. The counselor stated that there weren't enough resources readily available for students who suffer from depression, problems with self-image, and addiction issues. This was in part due to the fact that Queenie isn't seen as a problem school, per se. I'm sure you guys can vouch for that. It's just because it has a low population in terms of the students that actually go there. The location of the high school is in a pretty high socioeconomic neighborhood, and the success that students experience there is pretty high. The students have very good grades. They seem very productive, and they are very productive. I shouldn't say seem, but it kind of masks that there might be some problems. The Gifted and Talented Education Program operates out of Queen Elizabeth, and this is a program that I actually attended in junior high. But I do remember that when I was in junior high, I had feelings of isolation at times, and my first encounters with alcohol and marijuana was during this time, motivated by a desire to fit in with the people that were around me. My fellow students and I had great marks. We were considered great students, so there was never a problem per se. When I heard this counselor now, through my practicum, tell me that it's a very similar situation nowadays, it made me wonder. Queen Elizabeth is also where a student died recently due to an ecstasy overdose. Did anybody hear about that?
Yeah.
It's pretty sad. This person passed away. It was because of a tainted batch of ecstasy, supposedly, an overdose on it. The student was viewed as a rebellious child, so it was looked on as an isolated incident, pretty much. But this is not the case. There are many students there who partake in drug use because they feel isolated, depressed, and that they don't belong. While we were there, a police officer actually held an info session for parents about drugs in the youth. Remember that, Kendra? Only 2 parents, 2, maybe 3? That's the amount that showed up. The bulk of the audience was actually our student cohort. After a student had died of an overdose there, which really surprised me, it seems that the problems that students face at this school aren't a huge priority, and I wondered why. Is it because the students are successful academically? Is it because parents do not want to bring attention to these issues, or do they choose to ignore it? Is it because the school itself likes to maybe sweep it under the rug to maintain a good reputation? I'm not entirely sure, but I'm pretty sure it's a mixture. My fellow students and I, Kendra included, came up with a hell of a health intervention, right? idea for high school youth in the form of a holistic health center that provided a variety of health services, including mental health services. This would mask any stigma that was associated with visiting a guidance counselor, because no one would know what a student was really visiting for. And as Michelle had touched on, there's a lot of stigma behind this. This space would act as a free space for students who felt that they didn't fit in elsewhere, to meet other students going through similar problems. We kind of had the nickname for it the Zen Zone. There isn't a whole lot that a group of students can do in 4 months, unfortunately, other than create a proposal, which the Calgary Board of Education does have, but they probably won't act upon it. But the whole experience highlighted the stigma that surrounds youth mental health. Youth problems aren't always viewed as real problems, or they're seen as something that will pass with time. But they are real problems, and they affect how a person will function in real life, later in life. There was a cool service that we saw that came to the high school youth. The high school youth had access to it. It was called the Alex Youth Bus. Has anybody heard of the youth bus, the health bus? If you've heard of the Alex, then you have, and that's not fair to Michelle. She knows everything. But it's a mobile health clinic that parks outside of schools, and it allows students to utilize healthcare resources, including mental health counseling, in a very confidential and easy to access format. This sparked our interest in the Alex as a group of students. We formed a relationship with the Alex during that term, and our work with them, along with the hard work of our practice instructor, Aaron, allowed our group to stay together for another term and be placed at the Alex. So the Alex had those 3 sites that I mentioned, and we rotated between them: the Pathways to Housing, Seniors Clinic, and the Family Youth Center. We also got to do ride-alongs on their health buses, and it was a really cool experience. Seniors Health Clinic provided a tremendous resource to seniors, especially those with a mental health diagnosis. Patients were able to see a nurse practitioner for up to 2 hours at a time, and that's something that's just not feasible in the regular healthcare stream. Seniors experiencing mental health issues were especially vulnerable. They are especially vulnerable to being overloaded with medications, experiencing falls and dementia. And everybody needs to know that dementia is not a mental health diagnosis. It can happen because you're just dizzy, you're malnutrition, you have an infection. So they have to deal with that on top of what they're dealing with. And they also just don't have enough support sometimes to assist them with their own care and their daily living. This clinic addressed all those issues for the population. The Family Clinic has a youth center that acts as an open space for at-risk youth to hang out and socialize while getting help with their health concerns. And you remember that health center for high school students that I just mentioned? This is exactly what we had in mind. It existed, it just wasn't in the actual high schools themselves. What's more, they had these buses that went to the high schools, and students could just go out and access the resources that they needed. It's pretty neat, huh? Pathways to Housing was a program I had never heard of. We went by a Housing First model. Does anybody know what Housing First model is, or their healthcare people? Kendra, you know what it is. Put your hand up and participate, please. Yes. Yeah, they went by a Housing First model. It's basically a method that promotes provision of a safe and consistent shelter for the homeless so that they can tackle their health issues. It acts as a home base for them to deal with the rest of life's problems. The clients all had a mental health diagnosis, such as schizophrenia, major depressive disorder, and bipolar. And they all had some form of addiction, and that can include food addictions, gambling addictions. They were provided subsidized apartments in many different locations around the city. They had nurses visit them to do health checkups, and they had access to resources that helped them find work and participate in social activities. I learned that this model actually resulted in less strain on the healthcare system and the justice system
because calls to ambulance and police were reduced when these clients were safely housed and supported with their mental health diagnosis and addiction problems. They also were less likely to be hospitalized because they complied with maintenance therapies. It's a brilliant idea, using harm reduction to benefit both the clients and our healthcare and justice system. The health buses were amazing. It was a U of C nursing student who actually started the whole thing as a part of her final focus. And it's quite an inspiration. She's still working there. She manages those buses to this day. There are 2 adult buses that operate along with a youth bus. When I went for my ride along, the adult bus parked outside of the Native Addiction Center. It's a place that assists individuals with addiction through holistic and traditional therapies. You don't necessarily have to be Aboriginal or Métis. And they do provide some medical and psychological interventions as well. The bus served as a place where any at-risk individuals could access healthcare. They came right to where you were. Another time we parked at a safe house for street workers. And the nurse practitioner provided counseling to many of the individuals who accessed the service. I thought it was an absolutely brilliant idea. So what do all these services at the Alex have in common? They provide mental health services and resources in innovative ways that nobody else seems to. They're a non-profit organization, and they're a private healthcare organization. Now, something about me, I've always been an advocate for some amount of 2-tiered healthcare because I feel that the current system is not sustainable, it's inefficient. 2 tiers already exist, but the public is just not completely aware of how much it exists. There are certain ideas about private health that demonizes the concept. My experiences thus far have shown that private health is picking up the slack where public health is not delivering, especially in the area of mental health. Mental health is an area that suffers the most because it does not receive enough attention or funds from public health care, and there's so much stigma around it. My experiences at the Alex reinforce this belief. But why isn't mental health a priority in the public system? Why don't these kinds of programs exist more in the public sphere? I'm not totally sure. This term, I was placed at the Rockview Hospital in the seniors mental health unit. It's an acute health unit where we see patients hospitalized due to mental health diagnosis, and it's kind of when things get extreme. Most of these people are manic, they have extreme delusions and hallucinations, or they've tried to commit suicide. There's only 22 beds in this unit. Sometimes these beds stay filled for a year or more because a senior can't be discharged if they have no stable or supportive place to go. I need to make the point that it's an acute part of the hospital. Have you ever heard of any other unit that's acute in a hospital that has a patient stay there for a year? I haven't. The lodges and homes that are available for senior mental health patients, they're packed full, and finding a place can be difficult. Many of these lodges are, again, private institutions. So I wonder, why aren't there more publicly funded ones? Not sure. I had a very interesting and long conversation with a nurse on that unit, and it's been etched in my mind what he said. Now, as you should already know, I'm an advocate of social justice. That's why I'm a part of Cause and Effect. Social justice is also one of the pillars of registered nursing. If you look up the official documentation from Canada, from Alberta, social justice is actually a subheading, a topic, and they have documentation that we are supposed to advocate for health inequities and advocate for patients. And social justice is a big part of that. What this nurse told me is that human rights activists are doing a disservice to social justice when it comes to mental health care. Canada abolished mental institutions a long time ago, probably to save money, but also partly due to human rights activists pushing the government to do so. Activists believe that it is inhumane to keep a person in an institution against their will if they're functioning fine and they're no longer presenting as harmful to themselves or others. They also believe it is inhuman to force medications on individuals. They also believe that stigma is reinforced with institutionalization. And that's all fine and well, and I completely agree with it. The nurse explained to me that the government promised money for mental health care to be delivered at the community level to allow the integration of mental health patients without the use of institutions. Makes perfect sense. But again, where's the money? Most of the community-based programs that are making a difference in mental health, mental health care are private organizations. Secondly, the nurse said that there's a misunderstanding about what is humane and what is not. Upon discharge from an acute hospital setting, it is no less humane to set up a senior on an isolated floor of the Bethany Care Center, which is a private organization, than it would be to set them up in an institution. With institutions, you have recreational facilities and the ability to go outside at will. The people on the isolated floors at the Bethany Care Center, they're never even allowed to step foot outside without an escort, if at all. So what do you guys think is more humane? If a senior mental health patient poses a danger to themselves or to others and needs to be isolated and routinely observed in the hospital, they are put into a concrete room with a glass observation wall and only a mattress on the floor. That's what happens nowadays. Is that any more humane than a padded room with a camera in it? I don't think so. Now, it's mandatory that a senior mental health patient be found a lodge or a home before they're discharged from the hospital. That is not the case for those who are under 65 years old. If an individual without a home is treated acutely and deemed fit for discharge, that is exactly what happens. They're discharged to where they came from. If they came from the drop-in center, that's where they go back. And this results in the infamous revolving door. Anybody know about revolving door theory? Hands up. Karen and Michelle are quite aware as well. Patient doesn't have the social support sometimes to comply with treatment after discharge, and they find themselves in a manic or suicidal phase again and is readmitted to the hospital. This happens over and over again, and it's not hard to believe that multiple admissions occur when an individual is homeless and 64 years old, let's say. Where is the community-based funding that prevents this from happening? Again, I'm not sure. The reasons behind human rights advocacy against mental health institutions may be benevolent, but the whole picture isn't being accounted for. Undoubtedly, there are mental health patients that comply with their medical treatment and lead active and productive lives integrated into society at large. But there are so many patients that do not have the support or resources to do so. Upon discharge, a patient needs to comply with medications and psychotherapy routinely to stay healthy. To stay healthy, one has to manage all their medications and checkups while continuing to deal with the normal struggles of everyday life. What we consider difficult is much more difficult for a mental health patient. Support is absolutely necessary at the community level, be it from family and loved ones or from healthcare professionals, or both. Some people just don't have a family that supports them. Some people don't have a home to go to. Some people don't have money for medications. And even if medications are provided, some people don't have a safe place to keep their medications, let alone actually schedule the time to take them at the right time. Juggling meds through a locker at the drop-in center is not easy, especially when you have to adhere to a set schedule of meals that they provide, and you have to be outside the entire day. Is it a coincidence that so many homeless individuals have mental health diagnoses? Is it a coincidence that so many street addicts also have schizophrenia, bipolar, or major depressive disorder? There's a strong theory that it is not a coincidence. You see, when mental institutionalization was abolished, mental health patients were left to manage their illnesses out in the community, where I think I've established there doesn't actually seem to be much money for public health care. Families that had to take care of mental health patients did not receive any extra funds, any tax deductions, or any grants from public coffers. Housing programs were not created from public health money. There are some public health funded lodging programs for seniors with mental health diagnoses, but this falls more under the realm of seniors health care than it does under mental health care. So without this community-based support, quite simply, many mental health patients eventually become homeless. Is that social justice? Is that advocating for human rights? I don't think it is. So what is social justice in a situation like this? What is human rights advocacy? I believe it is creating more support and resources at the community level, the way that private and nonprofit groups are already doing. I believe it is finding innovative ways to have patients comply with treatments while continuing to integrate them into society and reduce the stigma that surrounds them. I believe that youth mental health needs more attention, and these issues should not be swept under the rug or dismissed, as it's just teenage problems. I don't believe that funding for such initiatives is going to come from public money anytime soon. In order for any money to be allocated, we as citizens need to create awareness about the health inequities surrounding mental health. We need to ask our MPs, where is that community-based funding we were promised when deinstitutionalization occurred? I do believe that private enterprise, including nonprofit, will be the leader in filling the gap that exists in mental health care provision. The Alex is one amazing example of that, but there are so many others, including obviously the Calgary Distress Center. Calgary Counseling Center is another one, and the Bethany Care Center is another great example that provides support for maintenance of a mental health diagnosis for seniors. Finally, I do believe that nurses and social workers will be at the forefront of establishing these enterprises while advocating for change in the current system. Thank you.